Hi everyone, thank you for joining today's Education Writers Association webinar, Childcare Policy and COVID-19, a Roadmap for Education Journalists. My name is Stacia Cedillo and I'm a program specialist here at EWA. I'm going to go ahead and turn it over to our moderator today, veteran 0 to 5 beat reporter, Linda Jacobson, who has just started a new role as a senior writer at the 74. So congratulations, Linda, and I'm going to hand it off to you.
Thanks so much. I'm really glad to be doing this today. We have two very experienced speakers with us today, and both of them have been very helpful in my reporting over the years. So I know they will be for you as well. Our first speaker is Linda Smith. She's a former Deputy Assistant Secretary for Early Childhood Development in the Administration for Children and Families at HHS. She's currently the Director of the Early Childhood Initiative at the Bipartisan Policy Center, in DC. Our second speaker is Dr. Cynthia Osborne. She's Director of the Prenatal to 3 Policy Impact Center at the University of Texas at Austin, and which is a fairly new center, but you're going to learn a lot about it today. She is also the Associate Dean for Academic Strategies at the LBJ School of Public Affairs. So thanks to both of you for being with us. And Linda, we're going to let you start, and you're going to provide everybody the model for childcare.
Well, I'm going to try and do this in 5 minutes or less. I think that's been the challenge of how to explain childcare, what it looks like, and sort of how it functions in this country. And so, thank you to everyone who joined the webinar. Really appreciate the opportunity to try and explain this issue to people. And it is a little complicated, but I've tried to make it as succinct as I can. In terms of the current landscape for childcare in the country, we have, according to the latest data, we have about 675,000 childcare businesses in this country. That was as of 2016. These are businesses for the most part. They are either for-profit or not-for-profit, but they are businesses and they run very differently from our education system. And we can talk about that a little bit more in just a second. They basically are small businesses, with 50% of the child care centers in the country caring for fewer than 50 children, and 2/3 care for 75 or less. So they're small businesses for the most part. I know a lot of people like to look at the KinderCare on the corner and the little red roof and think that's what they all look like. Far from it. They're small businesses, and that leads to some of the complications with the childcare system that we've experienced in the COVID situation, which I will get to in a minute. In terms of annual revenue, according to the latest data we have, the annual revenue for childcare in this country is a little over $47 billion a year. They employ about 2 million workers, evenly split between centers and family childcare or home-based care. So you know that. We have an aging workforce, and just put that on the radar screen because we're all very concerned about the impact of COVID and some of these people either coming back into the workplace because of their age and or deciding to opt out just based on some of the risk factors. But the average, those in center-based, over a quarter of center-based workers are over 50, and close to 40% of our home-based population are over 50. So that's something to put a plug in. The other thing that's important to understand about childcare is the wage issue. And obviously, most people understand that the early childhood or the childcare workforce is poorly paid. $11.65 an hour is the average, which is roughly $24,000 a year. And I would point to the fact that that is roughly, for this country, poverty level wages for a family of 3. So the workforce is poorly paid. With another thing that we've learned in the COVID experience is that for the money, their risk is pretty great in terms of going into these childcare programs, and we'll talk about that in a minute. What we know about children in this country is interesting as well, with about 66% of all children under the age of 6 having all available parents in the workforce. So that means for however the families are working it out, they are using some kind of care. We know that only 32% of those parents are actually paying for childcare. So we have a significant number of parents who are not paying but have to have some kind of care. And that is something that we've been trying to explore where I am now, is what's going on with that population. We also know that the average cost of care varies widely, with infant care, and I'm sure Cynthia can talk about this better than I can, being as high as $24,000 a year in Washington, D.C. So the range is significant in terms of it, and it is a very big factor for what we are struggling with the access issues. In terms of the proportion of family income spent on care, and several years ago, 2012, as a matter of fact, that it was 20% of a family's income on average was spent on childcare. So what does this look like? What we have is a market-based system of care, whether it's for-profit or not for-profit. It's a market-based system, with the product that we're producing being a very labor-intensive product to produce. In other words, adults and children. So it's an issue in terms of the cost, and I'm going to talk about that more in just a second. As with any business, we have a supply and a demand side of an equation. To date, in this country, the focus on policy has been mostly on the demand side of the equation, and that's been driven in part because of the cost issues and parents being very vocal about how much childcare is costing them and how hard it is to find. So the cost of care and the parents' ability to pay for care have been driving what we call the demand side of the equation. That revenue that I referred you to earlier, the $47 billion a year, comes mainly into childcare from two sources, mostly or somewhat from public vouchers, which is through the Child Care Development Block Grant and some TANF funds, and the private pay parents, the parents who actually take out their checkbook and write that check every month. So the public vouchers in this country pay for close to 1.8 million children. So as a result, the federal and the state governments, and if you understand or don't, CCDBG is a block grant going to the states then become the single biggest purchaser of care in this country. So one other thing that I'd like to put a pin in for everybody in terms of the funding model and the finance side of this is that if you look at the federal funding for education writ large in this country, somewhere around 80% of education funding is state and local for the public school system. When it comes to early childhood, it's exactly the opposite, and about 80% of funding that goes out through the public resources is coming from the federal government into the states, as I mentioned, with varying amounts of state money going into this. So in terms of the other side of the equation, let me just talk a little bit about what COVID has taught us. Because as in any business model, there's two sides, and the other side is the supply side of childcare. And so what we know about childcare and have known for quite some time is that labor costs are about 75% of a program's budget, with about 25% going to fixed costs. Well, when COVID hit, guess what happened? The labor cost, or the money coming into these programs through subsidy or private pay, went away, and the programs were sitting with fixed costs that they had no income to cover. And so what we have now come to understand as a result of the COVID experience is we need a more balanced strategy for childcare in this country, one where we have some ability to stabilize the supply side of the equation and make sure that these programs can stay open with, and not be in such danger. Now, some of the labor costs, and this is where we get into the pay of the workforce issue. The labor costs are driven by three things: the adult-child ratios, and what the state says are the ratios that it needs to see for the most part in the infant toddler area, which Cynthia is going to talk about, those ratios are 1 to 4 generally across this country. So for every 4 infants, we have to have 1 adult. And mind you, that's not 1 adult for just 8 hours. That's 1 adult generally for 12 hours. So it's not like a simple 1-to-1 here. The other thing that is concerning and reason for the supply side being as fragile is enrollment goes up and down very quickly in childcare. A parent can decide, well, I'm going to change work, or I don't like this program, so I take my child out, and there goes the revenue covering that ratio. So the instability, the enrollment and the instability of the funding coming in is a real problem. Ergo, the reason the wages stay so low, because childcare program people are hesitant to raise the wages if they can't count on the income to cover those wages. So I think that what the other things that in a nutshell I will tell you we have learned about the childcare and the COVID experience. I think in some states, and you may know this, some states decided early when this started to shut down everything, shut down schools and shut down childcare. Well, they very quickly learned they couldn't shut down childcare because we had essential workers that needed to go to work. Oh, guess what? And besides that, they don't control those things in the same way they control the schools. So the schools kept their funding. They didn't lose their buildings because they shut down, and childcare was stuck with some of these costs, reduced enrollments, and a severe lack of funding. So what that has led us to, and this is sort of the theory that we're working on now and trying to figure out, is what is the public good of childcare? And there is one. We know we can't get our people back to work. We know that parents need this care. And so what is the public good aspect of childcare? And then how do we begin to look at our model, which is a business model, and put some level of focus on the supply side of the equation as much as we have put it on the demand side of the parents and what it's costing. And I think at the end of the day, what we need to figure out is to base childcare to look at childcare in the true cost of doing it, not what the market can bear, and then figure out how we're going to split those costs between some kind of public financing and what the parents can pay. So that is a crash course 101 in childcare in America. There's a lot more to it, but we'll take later questions.
Great.
Thank you, Linda.
Thank you. All right, Cynthia, now we're going to hear about an amazing new resource that I'm sure a lot of reporters will enjoy diving into.
Great. Let's see. I am making sure that you can see my screen of the roadmap that we are creating, and I really appreciate the opportunity to be able to share this with you. I just double checking because I can't see that. Linda, you can see the screen of the roadmap.
Yes.
So we have started with the idea of the science of the developing child has really helped us to understand how important the prenatal period is and the first 3 years of the child's life are in terms of setting them on a path toward long-term health and well-being. Childcare plays a huge, important role in that. And we know that it's important that families can both access childcare and afford it, and that the childcare that they are receiving is of high quality, that the environment between the caregiver and the child is nurturing and promoting healthy development. But what states have really lacked is an understanding of, if we know that these first 3 years are so important based on the science, what is it that we should do? And so I am at University of Texas at Austin, as Linda said. I'm an academic. And so what we turned to was the research. What does the evidence tell us that are the most effective policies and strategies that states can implement that will actually make sure that kids get off to this healthy start? And we included childcare as one of these areas of policies that we were focused on. But the science tells us that it's more broad than just that we need to make sure that children are born healthy to healthy parents, that parents have the skills and resources that they need in order to be the parents that their children deserve, and that when children are not with their families, that they're in high quality care environments. So we set off to identify what those are and have developed what we're calling a state policy roadmap that outlines these 11 effective policies and strategies. And our charge then will be to monitor states' progress toward adopting and implementing all of these policies, seeing how generous they are, as well as how well folks who are eligible are receiving them, and also to measure the outcomes that we know will give us a clue as to the real health and well-being of families. And this is going to be a useful tool for states as they're trying to figure out what to do now in the event of COVID-19, as we're looking to rebuild our systems. We demonstrated how fragile all of our systems are and how integrated they are. When you lose your job, you lose your health care. If you do not have childcare, you cannot work, as Linda said, that these are all related. And so we took a view that was very much to look broadly across what the children need in order to thrive. And in this roadmap, we've identified these 8 different prenatal to 3 policy goals, from making sure that families have the services that they need, the resources that they need, that we focus on physical and emotional health, parenting skills, and quality care environments, and identifying any needs that kids have and connecting them with the resources that need right away. And then we looked at the different policies and that actually impact each of these, and what the evidence tells us will make the biggest impact on each of these goals. And we created this framework, or this roadmap, for states to be able to use. This is Minnesota's as an example. We have a large roadmap that is for all 51 states, and then a profile for each state. And this is what we'll be launching in our event on Tuesday. What I wanted to be able to share with you with regard to childcare is one of the policies. And pardon me as I scroll through, because I know it gets a little bit nauseating when we do scroll through. But you can see from this graphic here, if it will come into screen, let's see, that when we looked across all the 51 states and said, what is it that states are actually doing for these 11 effective policies and strategies? What we found is that there are some states that are implementing all of the policies, but really there's wide variety across the states in terms of what families who have similar levels of need are able to access. And that is something that we see both by where you live, and we see differences in access and outcomes by race and ethnicity as well. And we have a limited time, so and I'm certainly open to answering all sorts of questions, but I wanted to share with you a little bit about the childcare policies, and one of the policies that we looked at as I scroll through. So as Linda said, the child care subsidies and how we pay for it right now are typically based on market rate surveys. And we can argue a lot about how that is not necessarily the most effective way to do it, but that is the way that most states are setting the reimbursement rates that families would be eligible for. And the federal government recommends that the rates are set so that the reimbursements that families get would provide them with access to 75% of child care places across the state, that's what they would have access to, child care centers rather. And when we looked to see which states are actually setting their reimbursement rate at the 75th percentile using a recent market rate survey, we found that there's only one state that is actually doing this currently. That state is Maine. And that there's wide variation in terms of who's eligible for these subsidies based on your level of family income, and then the rate that you're actually reimbursed. And not only, or that child care centers are reimbursed. And not only is there variation across states in the rate of reimbursement. I'm going to go to this slide that's not part of the roadmap, but I did want you to see when we look at the cost of care by state, that this map demonstrates, or this graphic rather demonstrates, how states vary in what they are contributing to child care centers, what they're expecting families to contribute through what we call co-payments, whether states allow additional fees, which mean that that's the difference between what the state reimbursement rate and the co-payment and then the actual cost of care is. So whether states allow centers to charge additional fees, or if they don't, what the unreimbursed cost then would be for just the average cost of care. And that would be why different centers would have a disincentive for wanting to take on folks who are coming with a subsidy. And so the variation across states is much larger than just the variation in the cost of living across states. It has a lot to do with both the way that they set their reimbursement rates, plus the amount of the co-payment. It ranges from 0 co-payments to up to 22% of a household income, and then plus these additional fees. If a family can find lower cost care, then they wouldn't have to pay that additional fee, but it's very difficult to find lower cost care. But that co-payment sticks with them. That's based on the size of their household and their level of income. They have to pay that regardless of the care arrangement that they have. And so, a family in Massachusetts has to come up with $325 a month in order to seek child care. And even though the state pays quite a bit of, $1,147, whereas in a state such as Louisiana, a family really needs to come up with $65 a month in order to access child care. And then if they want that kind of average rate, then they would also have to pay an additional fee of $227. So I can go into this in much more detail, but these were the types of things that we were finding as we were looking across all 51 states at what services and policies and benefits that families have and how it varies so much based on where they live. So I'm going to
we could
stop sharing my screen and then allow us time to have more of a conversation. I can come back to some of these points.
Yeah, I think we can definitely get into some of these additional issues in the questions, but I wanted to throw out a couple questions to both of you. Obviously, the roadmap, Cynthia, is much larger than just childcare issues. For families that have been, hit the hardest during this pandemic, families with young children, from the research you've reviewed, what would be some of the policies and strategies that reporters should really be looking right now for in their states that can help families rebuild and recover?
Yeah, I think that this is the time that states are going to have to be making tough decisions about whether they're going to lean in and really try to strengthen these systems of care, or they're going to cut back. And when we are thinking about the most effective policies, what we're finding is that those that actually shore up a family's income and ability to work are more effective at improving birth outcomes, at improving health outcomes, in addition to financial security, such as a state minimum wage, such as expansion of health insurance or Medicaid, and an earned income tax credit and paid family leave. That these are the types of policies that really allow families to be able to both work, but also to benefit from that. I would say the lowest hanging fruit, though, that the COVID crisis has actually allowed states to be more innovative and creative in these ways than they were in the past, is that what we need is easier access to the services and the policies that are already on the books. That many states have high levels of what we call administrative burden, that the policy exists, the family is eligible for it, but it takes 2 buses and taking a day off of work and gathering all your documents in order to go and recertify every 3 months for your child care subsidy amount, for instance, or your SNAP amount. Child care subsidies have been extended to a year now because of some of these burdens. In the COVID crisis, states have relaxed some of these administrative burden requirements, and it will be very interesting to see how states take some of that with them after this crisis is hopefully abated and our economy begins to recover. But my final point on this is to what Linda mentioned earlier. Without childcare, without a robust childcare system that's affordable and accessible, we can't recover. And that's got to be a place where states begin, because we can't go back to work. We won't have health insurance if we don't work. Our system really depends on childcare as a foundational element.
I have a question for both of you. I was looking some at Biden's early childhood platform, and he talks in there about the early Head Start childcare partnership model. And I was wondering if you guys could, I know early Head Start is one of the strategies that you talk about in the roadmap. And what is that model, that partnership model about, and how can reporters learn more about that in their own states or communities? Where would they go to see what that looks like?
Can I start on this one, Linda?
Yeah,
because that program was started when I was in government. And one of the things that we were trying to do when we set that program up was to look at just what I was describing in terms of the supply issues and the instability of the childcare funding. So the Early Head Start childcare partners were set up so that the money could go into the Head Start grantee, and the Head Start grantee could contract with childcare providers and pay them a stable amount of money for at least a year. So if the child was absent or went away and needed to wait, the money still came into the program. And that money was layered on the subsidies that Cynthia was talking about. So in effect, we doubled the amount of money going into these programs per child. So in the day when we set this thing up, we were roughly paying somewhere around $12,000 at that point. We came to understand that it's actually more costly than that through the process. But in exchange for the providers, the childcare providers taking that money, they then had to meet the Early Head Start performance standards, which are stricter than most state quality standards. They were given the support, the supplies, the training, et cetera, to do it. And it was a very successful model because they all got there. So it demonstrated that if we can figure out this financing piece, we can get to quality with childcare in this country, but not until we do figure out how we're going to fund this. So when we did the original grants, we funded a partnership in every state. So if you are a state reporter out there and you want to find that out, we can probably link you up with someone. There was at least one Early Head Start childcare partnership in every state in the country.
Yeah. Can I just build on that?
Did you want to add on that? Sure.
About Early Head Start, and just to Linda's point about that we can get to quality. And the reason that Early Head Start is on the roadmap as a strategy is that it does demonstrate that it impacts the well-being of children, and that has some longer term impacts for them. Mm-hmm. And the way that it does that is it's not one thing at a time. It's a combination of things. It's a combination of the training and the compensation and the size of the classes, but also the relationship that the child care providers have with the community and the parents and helping them access the resources that they need. So it's this comprehensive program that isn't just about a place where you send your kids. It's a place where the families actually are kind of thought of as a whole unit, and that really seems to help the children to thrive.
Mhm.
I think we want to.
Can I jump in on?
Go ahead.
Linda, I just wanted to jump in and add something to one of what Cynthia was saying too, and to clarify for the audience, the state reimbursement rates, and they are very low. And I think the thing about the state reimbursement rates, and I totally agree with Cynthia that we need to rethink the market rate issue, because and that is basically something that's in the federal regulations, but states can, if they choose, use a cost of care model, but very few, if any, do. DC does, there's a few that do. But that said, I think what happens in the states, and the state money that Cynthia was talking about, I should note, is federal dollars. It turns into state dollars, but it is the federal, the 80% that I was talking about. So states are faced with a problem, and that is how can they serve the most kids? So if they keep the reimbursement rates down, they can serve more kids with the same amount of money. So what we know is that most states, I don't think there's any state that is meeting the federally eligible children. So in effect, what states are being forced to do is take a balloon and squeeze it. And which way do you pay more, or do you serve more kids? And that's where they're stuck when it comes to these policies. And they do have to make hard decisions. I would not ever say that they're easy decisions to say we're going to serve fewer kids so we can pay a better rate. That's a hard one.
I want to get to one more question here before we see if any reporters have some questions. What aspects, Cynthia, of home visiting programs have been found to lead to positive outcomes for kids, and what should reporters be asking about these programs in their states? Obviously, with the roadmap, it shows that quite a few states have home visiting initiatives.
Yeah, so home visiting is one of the effective strategies that is on the roadmap, and actually every state is implementing some form of home visiting programs. These are programs that work with expecting or new parents as they transition into this role and really help them with building their parenting skills and connecting them to resources. And there are about 20 different home visiting models out there that have reached the standard of evidence that the federal government says these are the programs that we're willing to fund, and it varies quite a bit state to state as to which program models they've chosen to fund, but they're all based on this list. The program models vary quite a bit, though, in the goals that they're trying to achieve and how effective they are at doing that. And what the programs seem to have in common is moving the mark on parenting skills, nurturing parenting behaviors, how parents interact with their kids. And these we know are so important, especially in those first 3 years of life, where we really are trying to build those attachments between caregivers and children. And so they range, the other home visiting programs, some are more successful at birth outcomes, some are more successful at child welfare outcomes, but parenting seems to be the area that they have more in common. I do think that one of the things that at the state level that we are learning is it's sometimes hard to serve the families who need it the most. And that those are the families that are the most difficult to find, and they're the families that are the most difficult to keep in our program. We're also finding that during the COVID crisis that keeping these families engaged has been somewhat difficult. You can't go into their home, which is the basis of the model. And so many have turned to more of a telehealth model. Here in Texas, what we're learning, and we think that this is similar in other states, is many families don't have access to things that will allow them to do a GoToMeeting or a Zoom meeting. They might FaceTime, but mostly it's phone calls and sometimes even texts. And so we're learning how families are adapting, and program models are having to adapt in this time period. And that's the concern there, is that one of the things that the program models do is these assessments of families' needs, of the child's needs, whether they need early intervention services, whether they need food. And so we are not able to do those assessments in the way that we know our families need. And that's something that we need to be paying attention to, and make sure we have eyes on those families.
Great. Stasha?
Hi, everyone. Yeah, I'm popping back in here. And first, I know we got started just a few minutes late. We were having some technical difficulties behind the scenes. So I just want to ask our moderators, our panelists, can you stay maybe 5 minutes longer after 3:45 to 3:50?
Absolutely.
Okay.
Yeah, I'll
Want to see how much time we have. So I know one question we had going into this webinar is, the pandemic has disrupted the lives of so many working parents and parents who are already struggling to find childcare. So the question is for Linda, because I know that the Bipartisan Policy Center, you all did a survey prior to COVID, and you've done a recent update about that. And so could you tell us a little bit more about what you found in terms of parents' needs pre and not post yet, but the data you've collected about parents?
Yeah, we asked parents. We've been asking parents. We did a survey right after about early in April, not long into this, and then also looked at what they were doing in January, then in April, and then we just redid the survey in April to see what was going on with childcare out there. I think there are multiple things to add to this. One of the things that we know is that the capacity or the access to care right now is significantly, down. That somewhere close to 70% of childcare is either closed, permanently closed now temporarily, or operating on reduced capacity or ratios. So that's really restricted families' choice. That said, families are telling us that they're very nervous about putting their children back in some kind of formal childcare setting until and unless there's a vaccine. And that's been that's the majority of parents out there. Okay, so what we are seeing is that they are really going back and relying more heavily on family members and relatives. And when I say that, I think I have to stress family members and relatives, because there's a perception around the country that some of these children are going into illegal kind of underground care. That's not what we've seen on the survey. The survey said that the parents are going to trusted, I think, family members that they know they have some comfort with what might be going on health-wise. So it's what my message has been about this is that it's, we're working here in Washington on actually getting funding to go to the states to stabilize this supply, that it's going to be a longer term commitment in this country to stabilize this supply than just 2 or 3 months, that families are probably not going to be going back into formal care until probably about a year from now, I would guess.
Great. So we just got a question come in from Cassie Burke. She asked, in Illinois, she says, in Illinois, childcare centers were pushed to reopen to serve essential workers by the state, by the business community, by parents. But there hasn't been a similar widespread push on K through 12 schools, and the majority of students in our state are currently in virtual learning. What are the factors that lead to these outcomes? Is it unions, business pressures for child care centers? What is it about this push for reopening while K through 12 stays open? Sorry, K through 12 has gone virtual. Yeah.
I think this has been a real challenge for the child care community, and we get this question often. And Cynthia, you may have gotten it too, where, well, why are schools closed and child care is open when obviously some of the health and the risk factors are there? I mean, we all know that. I used to refer to the littlest ones as germ magnets. So we have this issue of, children with, playing and putting everything in their mouth, et cetera, et cetera. So, that's a really good question. And so the question has to be, this essential worker, and how are we going to keep our, some of the workforce going at the same time we protect children and families. I think in Illinois, and I know Illinois was one of those states, we've been encouraging states to back to Cynthia's point, increase the amount of funding going into these programs so that they can take the precautions they need to reduce the ratios, put things in the classrooms that will take care of this, look at their facilities differently, et cetera. So we can't ask them to do these things without the resources to make sure children are safe. Illinois has done it. A number of states are doing it, putting out grants to providers to get them to open for the workforce and be safe.
Yeah, I think that's such a key element there. And most of our infants and toddlers, though, are in home-based care. And so finding ways that we can strengthen our home-based or family child care centers is going to be really important. This is where families feel more comfortable, especially during this time leaving their children. We're creating pods for our elementary school kids. We can do that sort of thing for infants and toddlers if we really do it with the right level of funding and support.
It was interesting to see on the survey that more family child care providers, to Cynthia's point, stayed open throughout this than did centers. I think well over a quarter of homes didn't close at all, ever. And more of them are staying open now, as opposed to more centers are closing permanently. Our survey showed that about 14% of centers are now closed permanently. They've just literally shut the door. So that number is much smaller in family child care. They're staying open and the closure rate's less.
So Danielle Jollinger, I just want to acknowledge her question too, because she asked, she's a freelance reporter, and Linda, you had gone over our kind of childcare cost 101 business model, but her question is, I still don't understand how childcare is simultaneously so expensive for families and so inadequately paid for staffers. So how is it that it's so expensive, but childcare workers are not getting paid?
Okay.
A living wage. So is it high staff to child ratio? Is it insurance, something else?
It's mostly in the labor costs, and I try to do this math for people because they don't really understand. So if you take let me go back to the last data that we had when I was still in government, and the government was paying in subsidy on average for an infant about $5,800 a year. That's the average the government subsidy, the voucher, was worth. Okay, so you have 4 infants for an adult. So you do the math. You take, even round it up to 6,000. 6,000 times 4 infants is $24,000. So right there, you can't even cover your labor costs, because, as I said, it's not an 8-hour day, it's a 12-hour day. So you really have to do the costs go up. So in order for these workers, the childcare teachers, to be paid more, we have got to figure out the gap between what parents can afford to pay and what it takes to pay the workforce at a level that we can get the quality we need and the stability we need. And that gap is huge, because if you start to do the math, all the way up the scale, it doesn't get much better than that. Then I would say one other thing is, you take those 4 infants, and let's say 2, as I said earlier, even one of them leaves. Now that provider has $18,000 a year to pay those wages on. You see where it's going? So every time a child is gone or is not, moves to a different program, the provider takes a hit. And that's what I was trying to say about the stability between the supply and the demand side of this equation. We've got to figure out how to get more money into the supply. And that's what the Early Head Start Childcare Partnerships did do.
Right. Yeah.
Thank you for answering that. The last question before we sign off is reporters out here, they are always looking for story ideas or ways to, if you have data or resources that they can incorporate into their stories, what are some suggestions or ideas that you all have for reporters out there? What type of stories can they be writing or should they be writing about?
So I'll start with, Linda was mentioning, we have developed this roadmap that I briefly showed to you that does provide a great resource for state leaders as well as researchers, reporters, and others who really want to understand, one, what the science says kids need, two, what we know are effective policies that actually impact those outcomes and give kids what they need, and three, how that varies across states, because where kids live makes such a difference as to what similar kids are eligible for receiving, and therefore what the outcomes will look like. And so we have learned from our K-12 experience. I'm a former teacher and used to work in 6th grade. And we know how important everything outside the classroom is that really impacts the kids' ability to learn inside the classroom. We learned that with pre-K, that it's important to think about how do we get kids ready and support them there. And more we have understood how important those first 3 years of life are to understanding that it's a whole system of care that families need. It's not just childcare, which is an essential. It's not just parenting, that's essential. It's all of it working in tandem. And that if we get that right, then our pre-K, our K-12 experiences are much better. They're less costly. And over the long term, our society is healthier. And so that's why we're focused on understanding what we need and what we have in the first 3 years. And that's what we are excited to share, the state policy roadmap that we've just developed with everyone.
I'd like to take a quick stab at that as well, because I think one of the things that a lot of parents are struggling with, and for those of your audience who are education writers, they're going to get this, is that when children, so many of our schools are on, either virtual or part-time or alternating shifts, etc. And our survey, actually, we have some data on that. But what we have been trying to say is the impact of that in 2 places. What are those parents who are working going to do for childcare while their children are in virtual schools? Because that's a real gap for people and has the potential to impact the childcare capacity and access for younger children, because it might be easier and the programs get more revenue if they take care of school-age kids. So a fear, and we don't know this, it's just a fear that we've been giving thought to. Are programs going to take school-age kids in lieu of infants and toddlers, and destabilize what little care we have for the younger children in this country? So that's one story that I think is, what are parents doing right now with their young school-age children? The second thing, and I think Cynthia alluded to this earlier, is the social emotional issues going on with young children in this environment. And what is going on with some of these things where children are, parents are trying to juggle, working from home sometimes, or the virtual learning with their work and their children. And every once in a while you'll see a child pop up in a Zoom meeting, and you just really feel for what parents with young children are doing right now. The social and emotional impact on them and on their children, I think we need to be paying attention to. And I just put those 2 things on the table.
Well, I just wanted to extend one thing that Linda said. I know we're at time, but the socio-emotional impact of the parents has a direct impact on the child. And so whether you're focused on the kid or focused on the parent, we have learned that if we can provide resources and support community and health resources for parents, that is how we really help to shore up the well-being of kids. And we need to do the exact same thing for their childcare providers as well, that they need
Yes.
the support and care and resources in the same way that parents do if they're going to take care of our children for 12 hours a day. So, you know, I just really think that those connections we can't lose, that it can't lose that important connection.
Yeah, I'm sure all of our working parents who are logged on right now feel those
pain
points more than you all know. Well, we are at time, and thank you. We actually went over, so I appreciate you all staying past our time to answer these questions from our audience. Thank you so much to our moderator, Linda Jacobson, and to our guests, Linda Smith and Cynthia Osborne. I posted the links to both of their resources, both Linda's Bipartisan Policy Center, Parent Survey information, and Cynthia's embargoed materials for that she will be presenting at your launch, your Prenatal to 3 Summit that is next week. So those links are in the chat. Just a reminder that you'll get an evaluation survey as soon as we end the webinar, so please fill that out for us. We appreciate your feedback. And thanks again for coming. Thank you to our speakers.